Welcome to the Brushing Up on Mouth Care Education Series. In this series, we are focusing on personal daily mouth care for older adults. Many older adults experience a decline in physical and mental health as they age. This often leaves them dependent on others to assist them with their personal care needs. There are 5 learning modules in this series that relate to the various aspects of providing daily mouth care. This is Education Session 4, Considerations for Palliative Care. In this session, we will discuss importance of palliative care, oral care for the palliative patient, general goal, symptoms and treatments for common oral conditions, tips and products for delivering daily oral care. Please note that this educational video was developed for use in long-term care, and therefore the term resident is used throughout to describe the recipient of care. However, this information is also valuable to those providing care in other settings, such as home care and acute care. In these instances, please take the term resident to mean client, patient, loved one, or whatever term best describes the person you are caring for. Importance of palliative care. Today, people are living longer. This is mainly due to wonderful advances in healthcare. But with these advances comes an increasing number of people living with chronic conditions and frailty that precede the end of life. Palliative care refers to care at the end of life. Traditionally, we think of palliative care as care that is provided for those with a terminal or life-threatening illness, such as cancer. One of the primary goals is to provide comprehensive care that alleviates suffering and promotes quality of life at the end of life. While many older adults may not be suffering from a specific terminal illness, advanced frailty and chronic diseases often require us to apply similar goals to ensure optimum comfort in the months and years preceding end of life. Palliative care is a way to improve end of life by relieving mental and physical pain and providing the best possible quality of life. It focuses on alleviating symptoms, whether it is due to a chronic condition or a terminal disease, knowing there is no chance of recovery at this stage in the person's life. The most important detail is comfort. The importance of palliative care is recognized by hospitals and long-term care facilities. Care providers play a major role in alleviating fear and stress associated with end-of-life care. Goals. A main focus of palliative care is pain management. This includes pain caused by various oral conditions. It is important to be diligent in providing oral care and evaluating oral care needs on a daily basis. Oral health problems can develop very quickly and result in rapid deterioration of a patient's overall health. Palliative patients are particularly susceptible to ulcerations, infections, dryness, and coatings affecting mouth tissues. Oral pain can be devastating. It affects a patient's ability to eat and speak. Managing oral pain helps people to eat more comfortably. This will have an impact on their enjoyment of food and overall nutrition. It will also improve their ability to communicate with others. Having a clean mouth free of unpleasant odor may also improve a patient's self-esteem and sense of overall wellness. The overall goals of a palliative approach to care are to maintain comfort, minimize pain, and promote dignity and self-esteem. Ideally, patients will be able to communicate well and enjoy food and drink as much as possible. Common conditions. There are many common oral conditions that can contribute to poor oral hygiene and pain. It is important to assess oral health on a daily basis in order to identify any problems or concerns. Conditions such as dry mouth or cracked lips can occur frequently and can create issues with eating, swallowing, and communication. Know the patient's abilities. Can they swallow properly? Can they drink fluids? Can they brush their teeth, or do they need someone to help them? Can they spit or expectorate? Answers to these questions will help determine what oral care tools and supplies are needed. Include these resources in the patient's oral care toolkit to have available for daily oral care. Having the right supplies on hand saves time and improves care. Dry mouth and lips. Dry mouth and lips are very common in frail elderly and palliative care patients. Causes. As many as 400 different medications can cause dry mouth. Disorders such as diabetes, Sjögren's syndrome, psychogenic disorders, or idiopathic disorders can all contribute to dry mouth and lips. Mouth breathing causes dryness of the gum tissue and mucosa. Dehydration also causes dry mouth and lips. Symptoms associated with dry mouth include difficulty swallowing, chewing, and speaking. It can also cause bad breath or hoarseness. Difficulty swallowing often results in poor nutrition, and reduced fluid intake causes dehydration. A dry mouth is an optimal breeding ground for plaque and bacteria. This can lead to increased tooth decay, gum disease, and burning mouth syndrome. Treatment. Prevention of dry mouth can be as simple as drinking water or sucking on ice cubes. If appropriate for the patient, sugarless lemon candy or sugar-free gum can increase saliva production in the mouth. When dry mouth is a result of medications, asking the patient's physician to prescribe an alternative medication may be an option. However, often this is not possible, and treatment of the symptoms is required. Saliva substitutes are available commercially, and a pharmacist or dental professional can help assist with choosing these products. A room humidifier may also be useful to moisten the air for mouth breathers. Candida infection, also known as thrush infection. Candidiasis is an opportunistic fungal infection. This type of infection can cause a fungal overgrowth to accumulate in the mouth, usually on the gum tissue, tongue, and soft palate. Causes. It most often occurs when the body is run down and not functioning properly, as is often the case with palliative patients. Patients who are on antibiotics, immunocompromised, receiving chemotherapy, or diabetic are at the highest risk for this type of infection. Other risks for Candida include improper denture care. If dentures remain in the mouth for extended periods of time, underlying tissues are not able to be cleansed naturally with saliva or by brushing and rinsing. It is important to remove dentures every day to rest and cleanse the tissues, and to allow dentures to be cleaned thoroughly. Dentures cannot be cleaned properly unless they are removed from the mouth. Dry mouth and certain medications can also trigger Candida infection. Symptoms. This condition appears as white creamy patches or small red dots. It is usually not painful. Sometimes the underlying tissue is quite raw and may even bleed. Treatment with an antifungal agent is possible, but must be prescribed by a dentist or a doctor. Make sure to disinfect or discard any oral care tools that were exposed to the infected tissue. Soak dentures in a solution of vinegar and water to eliminate any cross-contamination. Dentures that don't contain any metal can also be disinfected by soaking them in a mild bleach solution, 1 part bleach to 15 parts water. Denture stomatitis. Stomatitis refers to any inflammation of the mouth tissues. Denture stomatitis is the most common form of chronic stomatitis. Causes. This generalized inflammation is often caused by candidiasis forming under dentures. It is usually found on the palate of partial and full denture wearers. It is most common in women who refuse to take their dentures out at night before going to sleep. It can also be caused by ill-fitting dentures. Some people believe this condition is caused by an allergy to the denture material, but there is little evidence to support this. Symptoms. There are 3 stages to denture stomatitis. The first stage presents as red pinpoint dots on the palate. This progresses to erythema. And finally, hyperplasia, which is noted by red nodules appearing where the denture would sit on the palate. Sometimes there is tenderness associated with inflamed areas. Treatment. Taking dentures or partial plates out for a minimum of 1 hour every day will rest the tissues. Ideally, dentures and partial plates should be removed at night. It is important that the dentures be thoroughly cleaned every day. Angular cheilitis. Angular cheilitis is a chronic painful condition that occurs in the corners of the mouth. It is most commonly seen in people who have lost some or all of their teeth. Causes. It can be associated with poor nutrition, a fungal or bacterial infection, and commonly occurs with constant licking, drooling, or pooling of saliva. Symptoms. It appears as red and ulcerated patches in the corners of the mouth. It can be very painful to open the mouth and can limit eating, drinking, or speaking. Treatment with antifungal agents and changing the patient's dietary habits to improve overall nutrition can help alleviate the problem. Taste disorders. The sense of taste and smell are so closely linked that people who can't smell often complain that they can't taste anything either. Taste buds are located at various spots on the tongue, and olfactory or smell cells are specialized cells found in the nose. They both depend on zinc and other nutrients for their growth and maintenance. Causes. The efficiency of these two senses can decrease with age, but changes can also be due to viral infections, head injuries, cancer therapy, or side effects of prescribed medications. Symptoms. Some people may develop disturbing sensory changes such as a metallic, bitter, or salty taste that can occur by itself or be triggered by foods or certain medications. Heart medications and diabetic medications can cause a decrease in the taste sensation of salty or sweet foods and can also cause burning mouth syndrome. Medications for Parkinson's disease can cause the food to have a metallic taste. Antidepressants can cause dairy products to taste rancid and other vegetables and fruits to have a chemical taste. Treatment. Some helpful options to improve the loss of taste and smell include eating foods with higher taste sensations, using artificial saliva substitutes prior to eating, using fluids like gravy and light cream sauces to increase the fluid of the food and give it more taste. Swallowing disorders. For palliative patients at the end of life, swallowing is often a problem. Causes. Although there are a variety of causes, sometimes it's simply due to lack of saliva in the mouth. If swallowing difficulties are the result of stroke or advanced Parkinson's disease, having a dry mouth and throat can make the problem even worse. As described earlier, dryness in the mouth can be caused by medications, mouth breathing, or other disorders. Symptoms. Normally, the tongue provides the pushing movement that moves food towards the back of the throat. With a swallowing disorder, the tongue loses control and cannot move the food properly while chewing. There is also reduced use of the facial muscles, and the mouth and lips cannot close properly, making it more difficult for the food to be swallowed. Loss of sensation in the mouth makes it difficult for the patient to know there is food left in their mouth, and this usually ends up causing pocketing of food in the cheeks or under the tongue. To prevent the patient from choking, food must be removed by the care provider. Treatment. Chewing and swallowing food is improved in the presence of saliva and moisture. Therefore, treating dry mouth as described previously may help with swallowing. Ensuring that food is moist is also important. Sometimes patients will need to have their food pre-blended to make the food particles smaller and more manageable. In a hospital or long-term care facility, a suction machine may be required to remove the food debris from the cheek pouches and under the tongue. Wrapping a thin face cloth or gauze around the finger and sweeping the tissues is an option for cleaning food debris when suction isn't available. Chronic dehydration. Dehydration for palliative patients and the frail elderly is a significant problem. Some reports suggest that as many as 30% of long-term care residents are chronically dehydrated for a variety of reasons. The physiological mechanisms that control the thirst reflex may decline or be inhibited as a side effect of medications. Urinary tract dysfunction can be painful and may reduce the intake of fluids. Elderly patients with dementia may have decreased fluid intake. Care providers may need to monitor fluid intake to ensure that residents are not at risk for dehydration. Tips and products for delivering daily oral care. Assess the patient's needs daily. Identify risks of any oral conditions and set a daily oral care plan. Review what medications they are on that may create concerns with oral care. Depending on the patient, more than one care provider may be required to deliver effective oral care. As an example, someone may need to hold the resident's head or operate the suction device while another brushes. Make sure to set up all oral care equipment before you start and know what oral care products you will need. Protocol do's and don'ts. The most important goal in providing mouth care to frail and palliative patients is to maintain optimal oral hygiene with minimal discomfort. Don't use medium or hard toothbrushes. These are not appropriate for anyone to use, especially someone with dry mouth and sensitive gums. Firm bristles can tear gum tissue and cause bleeding. Do use an ultra-soft toothbrush twice a day with a very gentle brushing or patting action. The gums may be tender. Don't use mouthwashes that contain alcohol. They will dry out the mouth and irritate the gums. Do rinse with saline, soda water, or neutral fluoride rinse after every meal, or use a moist gauze to wipe out leftover food from the cheeks and under the tongue. Don't use lemon or glycerin swabs as they can have a drying effect on the gum tissues and usually just move food around the mouth without actually removing it. Do provide a saliva substitute to the mouth 2 to 6 times daily to keep it moist. This may help to prevent issues with swallowing and to maintain oral health. Don't use petroleum-based products for lip care. These products actually cause tissues to dry out. The petroleum coating also prevents the tissues from being moistened by natural saliva and may prevent harmful bacteria from being washed away from the mouth. Do apply a non-petroleum water-soluble moisturizer to the lips 2 to 6 times daily as needed. These types of lubricants are available commercially. Toothbrushes. It is best to use a soft or ultra-soft toothbrush because the gums are tender and can bleed easily. Use a gentle circular or patting motion to remove debris from the patient's mouth. You can also use an end-tuft brush or a proxa brush to get between the teeth and massage along the gum line. This is sometimes easier for you and the patient and is an alternative to flossing. Glycerin swabs are not ideal for cleaning the mouth and teeth. Their small size make it difficult to remove debris from the mouth appropriately, and they are not effective in removing plaque from the teeth. Patients can swallow the swab applicator and aspirate. Toothpaste. Toothpaste can be used when a patient has demonstrated that they can spit properly. Otherwise, toothpaste should be avoided. Plaque and debris can still be removed with gentle brushing with water alone. Sometimes toothpaste causes a burning sensation on the tissues. Too much toothpaste can cause choking or gagging. When toothpaste is used, only a pea-size amount should be applied to the toothbrush. Mouth rinse. Mouth rinses can be used if the patient's ability to swallow and spit is known. They should be alcohol-free. A 1-to-1 mixture of hydrogen peroxide and saline, club soda, or a mixture of salt and baking soda in 8 ounces of water are all useful alternatives to mouth rinses. Mouth props. Mouth props are a valuable tool when it is hard to get the patient to open their mouth or keep it open. The patient can gently bite on the white, spongy mouth prop to help relax the muscles of the jaw while oral care is being performed. Denture care. Dentures are just as important to keep clean as teeth are. Bacteria can get in under the dentures and cause inflammation or infection. Clean dentures after each meal to make sure that no food is left under the denture, which can cause irritation and lead to infections. To avoid irritation of dry tissues, make sure that dentures are moistened before placing them back into the mouth. Patients may prefer not to have their dentures in at all. To help with denture comfort, dry mouth products such as water-soluble lubricants can be placed under the denture to make it more comfortable. Weight loss can also cause dentures to become loose and create problems with swallowing and sore gums. Dentures may have to be refitted by a dental professional. Conclusion. Palliative care is intended to relieve pain in terminally ill patients. Palliative oral care focuses on minimizing overall mouth pain and discomfort. Helping patients to communicate effectively and eat and drink free of pain is important for maintaining the best quality of life possible. A clean, comfortable mouth contributes to self-esteem and dignity for those who are approaching the end of life.
Let's test your knowledge. Residents with advanced frailty and who are in need of palliative care may be particularly susceptible to A. Ulcerations or infections in the oral cavity, B. Dehydration causing dryness of mouth tissues, C. Coatings affecting mouth tissues, or D. All of the above. The answer is D. All of the above. We tend to think of palliative care as care that is associated with terminal illness, such as cancer. However, older adults with advanced frailty may also benefit from care that alleviates suffering and promotes comfort at the end of life. Symptoms associated with these oral conditions should not be ignored. Which condition appears in the mouth as creamy white patches? A. Dry mouth, B. Candidiasis or thrush, C. Denture stomatitis, or D. Angular cheilitis. The answer is B. Candidiasis or thrush. This is a type of fungal infection that often occurs when a person's immune system is affected by disease or chemotherapy. It may appear with no symptoms. When burning or pain does occur, the resident may need to see a dentist or physician for an antifungal prescription. Otherwise, keeping the denture clean and keeping tissues rested will help alleviate symptoms. Pinpoint red dots on the palate are a sign of A. Dry mouth, B. Taste disorder, C. Stomatitis, or D. Angular cheilitis. The answer is C. Stomatitis. This type of inflammation of the palate tissues is often caused by long-term denture wear. It is sometimes referred to as denture stomatitis. Removing the denture while the resident is sleeping will help to minimize irritation or pain associated with this type of inflammation. It is also important to ensure that the denture is thoroughly cleaned. Residents who pocket food are likely suffering from A. Angular cheilitis, B. Taste disorder, C. Swallowing disorder, or D. Candidiasis or thrush. The answer is C. Residents who pocket food may have a swallowing disorder. Therefore, it is important to gently swab the inside of the cheeks with a gloved finger or gauze to ensure that food debris is removed. Effective oral care for palliative patients who are experiencing dry mouth and lips should include A. Moisturizing with lemon or glycerin swabs. B. Petroleum-based products for lip care. C. A saliva substitute to the mouth 2 to 6 times daily. Or D. Hard candy to stimulate saliva flow.
The answer is C. Provide a saliva substitute 2 to 6 times daily. Moisturizing with lemon or glycerin swabs and petroleum-based products may actually cause the tissue to become more dehydrated. Hard candy may stimulate saliva flow, but may also increase risk for dental cavities and be risky for people who have difficulties swallowing.